Hi friends, today I will talk about Nipah virus. As we already know that one case of Nipah virus has been detected in India, in Kerala. We will talk about how is the Nipah virus transmitted and what are the ways, how can we prevent it, and what are their clinical symptoms. First is a disclaimer. Caring Dogs UTech channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or a company. Nipah virus is a zoonotic virus, which means it can be transmitted between the animals and the human. It belongs to Paramyxoviridae family and it is closely related to Hendra virus. A virus which can spread between animals and people is a zoonotic virus and it can cause encephalitis, that is brain swelling, and mild to severe illnesses, even death. It Where does this Nipah virus come from? It is naturally found in flying foxes, that is, we call them as large fruit bats. They can also affect the pigs and people. The various outbreaks which are seen in the past with the Nipah virus are: it was first reported in Malaysia and Singapore in 1998 to 1999 and occurs almost annually in parts of Asia, mainly Bangladesh and India. Recent outbreak in Kerala in India in 2018, 2019 and 2021. So coming to Nipah virus facts, it belongs to the family of Paramyxoviridae. It is Henipavirus and it is a zoonotic virus. It means that it spreads between the animals and the people. It is a fruit bats or the flying foxes which are natural host of the Nipah virus. The infected bats, they can spread the disease to the people or animal like pigs through the close contact or body fluids. Person to person spread of the Nipah virus can also occur after the initial spread from the animal. Symptoms of Nipah virus infection, they range from mild to severe and with a very high death rate, that is 40 to 70% in documented outbreaks. How does this Nipah virus infection trans- transmits? It can spread to the people through direct contact with the infected animals like bats, pigs, or through body fluids like blood, urine, saliva. Through contaminated food, the infected bat contaminated palm sap or fruits, raw date palm sap, close contact with the infected person, their body fluids like nasal, respiratory droplets, urine, blood. Transmission examples are: first Nipah virus outbreak. The people were affected through close contact with the infected pigs. In Bangladesh and India, person to person spread reported mainly in the families, caregivers, and healthcare settings. Exposure to contaminated food and climbing trees where bats roost also pose transmission risk. The signs and symptoms of the Nipah virus infections are: they cause mild to severe disease, including encephalitis and death. In the incubation period, that is, symptoms appear between 4 to 14 days after the exposure. The initial symptoms are fever, headache, breathlessness, cough, sore throats, vomiting, and severe symptoms may include disorientation, drowsiness, confusion, seizure, respiratory failure, coma, and brain swelling, which leads to encephalitis. And in severe cases, they may lead to death of the patient also. So 40 to 75% of the cases may meet with the death. Long-term side effects of the survivors are persistent convulsions, personality changes. So dormant infection can occur months or year after exposure, leading to various long-term complication and death. Diagnosis of the Nipah virus is done by RT-PCR test during the illness, real-time polymerase chain reaction test, throat and nasal swabs, cerebrospinal fluid, urine, blood, they can be used for RT-PCR test. After the recovery, enzyme-linked immunosorbent assay can be done to check for the antibodies, but various challenges are early diagnosis can be difficult due to non-specific symptoms. Early detection is crucial for increasing the chances of survival, preventing transmission, and managing the outbreak response. When should we suspect Nipah virus infection? We should always consider Nipah virus for the people with consistent symptoms who have been in areas where the Nipah virus is very common. For example, in Bangladesh, India, Kerala especially, and especially if they have had a known exposure with the Nipah virus patient. Till date, no licensed treatment is available for Nipah virus. Only the supportive care is required. Patient needs rest, proper hydration with IV fluids or oral supplementation. If the patient has respiratory issues, breathlessness, then oxygen supplementation can be helpful. And other symptomatic management, for fever we can give antipyretics like paracetamol, and for pain also we can give paracetamol. Immunotherapeutic treatment like monoclonal antibodies M102.4, it has completed the phase 1 clinical trial, but in future we can use it depend upon its outcome. Remdesivir has also been effective in non-human primate as post-exposure prophylaxis. Ribavirin was used in Malaysian outbreak, but its efficacy is still unclear. And these patients in ICU setting may require mechanical ventilation and constant cardiac monitoring. So, prevention is the only measure by which we can survive the Nipah virus infection. We should always wash hands regularly with soap and water. We should avoid sick bats or pigs, areas where bat they roost, eating or drinking potentially contaminated products like raw date palm sap, raw fruit on the ground. We should avoid contact with the infected person's blood or body fluid. In hospital, we can use standard infection control practices and barrier nursing techniques to prevent the hospital acquired infections. Edward Albert has said, "The simple act of caring is heroic." With this, I conclude my today's topic. Thank you. Thank you very much.